Hello, today we have a short clip in response to a question, which was, why does just do it not always work? Or even, why could it be counterproductive? This was in response to my video on procrastination, which I probably made, 6 years ago when I made most of these videos. But I would like to address this now, so I'm going to just do it. Well, when just do it works, then you should use it. So the question is, well, why would it not always work? So let me make the example of this video. I feel a very low level of anxiety at this point making videos like this, because I've made a lot of them and because I have a lot of other things going on and probably other reasons too. But the main reason is I've made a lot of them, so they're not very intimidating anymore. When I first started, I probably would have thought about this more before responding. But now it's kind of like, it's just the world's one big classroom and I have a question, so I'll respond. When is just do it? So just do it worked just now for me. So I was thinking, well, I got to do this today and that today and this, and I'm going to forget to do this. So why don't I just do it? So where it does work tends to be where the anxiety level is relatively low. The risk of procrastination comes in because there are other things to be done. But those other things may just as easily be done after this. And this is not going to take very long, and I'm likely to forget it. So it's kind of the perfect scenario for just do it. Well, let's take the example of dealing with my taxes, something that still causes me a higher level of anxiety, and just do it, let's say, is only moderately useful. And then I'll finish with an example where it's not useful at all. So just do it is only moderately useful for me for doing my taxes because of the level of anxiety. The level of anxiety is very high. So I feel I require a certain amount of psyching myself up, a certain amount of setting the stage, putting a bunch of time aside, pushing aside things in my schedule, putting it on my schedule in the next couple days. So that's a sort of procrastination in the service of getting something done. Now, if it gets pushed out and pushed out and pushed out and pushed out, obviously that's not going to work. So the just do it is, okay, I commit to doing this when I have control over the setting. And that's going to be whatever it is in 2 days. So I put it on my calendar, and when the day comes, I get up, I psych myself up, I push everything else aside so that I can focus. I do some meditation, try to lower the anxiety a little bit, and then I just do it. But that's not just doing it. That's doing it after preparation. So that's not exactly just doing it. At some point, though, that day, we're just doing it. I'm going to finish this reply with an example where just do it is a terrible thing to say to someone. If the anxiety level is extraordinarily high and there's a long history of procrastination, so there's a lot of elaboration of this pattern and a lot of beliefs starting to form about it, the advice, just do it, has a very low chance of being helpful. If they've never heard that before, if that's a completely alien concept to them, whoever this is, okay, maybe once in a while that works. Generally speaking, whether it's you yourself you're talking to or whether you're talking to someone else, we've heard just do it over and over again. Well, for one thing, certain companies have seen to it that we've heard that phrase. I generally tell my patients, if a piece of advice starts with the word just, then you can probably just ignore it. Because just implies that this is a simple matter and it's actually easy. I think is the implication. So in circumstances where it's really not a simple matter, the anxiety level is very high, and the person has probably heard just do it. Either you've told yourself that any number of times, or other people have told you, or the person you're telling has probably heard that many times. It's not likely to work. Why? Well, what happens? You have someone who's very, very frightened to work on a project because it's so important, and you tell them just do it. So what do? They say, yeah, I'll just do it. And then they go to the project and they're white knuckling it and they work on it for a few minutes and then they're about to pass out and they stop. Now I feel so much better. So there's a massive reward in it for them for stopping. So we don't push someone to go into a pit of snakes only to have them flee the pit of snakes in a hurry and then have a huge rush of dopamine that rewards the behavior of fleeing. I hope that's enough. I didn't want to go on too long. For one thing, because I got other things that I'm using this to procrastinate if I'm not careful. So hopefully that adds a little flesh to that comment. That just do it isn't always helpful. Occasionally might be, but if we're already procrastinating, maybe not. I can't resist, and I'm already at 7 minutes, but that's great because now YouTube will like it better. The algorithm will like it better. There is one other instance where I find just do it can help. Again, the anxiety level would be low, and then the task is simple, but maybe just not very interesting. So, for instance, meditation. 5 minutes meditation. I suggest to people they do at least 5 minutes meditation a day. I try to do 20, but some days I can't get myself to do that. So I'll do 5. And while my mind is churning, should I meditate? I really don't feel like it. I've got a lot of other things to do, blah, 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 blah. I don't say just do it. I have another little verbal trick. I say, and while you're debating that, why don't you just sit down over here and see what happens? That's kind of a form of just do it. And then often I'll find myself sitting down and while I'm sitting here, I may as well put my hands together in a meditative posture that I like. And then pretty soon I'm meditating, and then pretty soon, I may as well stick around for at least 5 minutes, and you're doing it anyway. So again, at low anxiety levels, relatively low, certainly not clinical levels of anxiety, just do it seems to help. Otherwise, maybe not.